Do you know that water makes up about 60% of the body's total composition? And the gold standard for the adequate intake of water daily is a minimum of 3 liters of pure, clean water. With this fact in mind, it shouldn't be too much of difficulty convincing you about the many importance of water. Let us dive into this importance. Welcome to my consulting room. Let's talk about 11 importance or benefits of drinking plenty of clean, pure water. Number 1, water helps with the function of the digestive system. It helps in the production of saliva that contains ptyalin that is crucial to the digestion of carbohydrates. And as carbohydrates and other foods, substances are digested, and we have plenty of fluid in the digestive system, we realize that intestinal motility and absorption or assimilation of digested food becomes easy, and even bowel movement, passing of physics, is not difficult, and constipation will not be something to worry about. Number 2, water helps to flush out body waste. This is by way of sweating, urinating, and bowel movement. These are body mechanisms that the physiology of the body has put together to help eliminate waste. And with plenty of water in the system, this function becomes very easy. The number 3 importance of water in the body is the role that it takes in regulating body temperature. We realize that when we have high body temperature, when we have fever, at some point we start to sweat. This is body's mechanism to bring down the body temperature, because as we sweat, our sweat comes to the surface of the skin and it cools down our body temperature. Number 4, adequate water in the body helps the circulatory system. It helps the function of moving blood around every system of the body. And as blood moves around every system of the body, it carries with it 2 major components: oxygen and nutrients. So as blood moves around the body in the circulatory system, oxygen and vital nutrients are carried around to every tissue and every cell of the body so that they can function at their best for our well-being. The 5th importance of adequate water in our body is the maintenance of blood pressure. So at normal blood pressure, the heart continues to pump blood around the body. But if for any reason we have low blood pressure, maybe coming from direct trauma, we have injuries and we are bleeding fast, or from diarrhea or from vomiting, we realize that blood pressure can start dropping below normal, and perfusion of cells and tissues with blood that carries oxygen and nutrients will become compromised. Number 6, adequate water intake helps to maintain the health of our skin by helping it to glow, by moisturizing it, by helping to even maintain normal skin toggle. We realize that from dehydration, we can start having dry skin, chapped lips, even cracked skin. So when we start noticing this and we start to rehydrate, we realize that our skin starts to get moisturized and it starts to glow again. Number 7, water is very important in joint lubrication. When we become so dehydrated to the point of having decreased fluid, decreased water content in our synovial fluids, it can lead to joint pain that we call arthritis. A very classical example of this is what those who have gout, or what is called gouty arthritis, experience. That is joint inflammation and pain in the big toe of the body. Number 8, another big role that adequate water intake does is in helping to optimize the health of the kidney. It helps to prevent kidney failure. The kidney has a number of functions, chief amongst which is the production of urine. It means as blood circulates throughout the body and it passes through the kidneys help to purify the blood and takes out waste products in the form of urine. Another function it does is in the production of blood. It has a particular enzyme that is produced that helps in the production of red blood cell. Again, it has hormonal functions. However, if these functions are compromised, the patient comes down with what is called kidney failure. And kidney failure is what nobody would want to experience. So having adequate fluid intake at every point in time is important to prevent kidney failure. The number 9 function of water still has to do with the health of the kidney, in that adequate water in the body helps to prevent urinary tract infection and formation of kidney stones. Those with recurrent urinary tract infection will usually be told by their physician to inculcate adequate water intake as part of the protocol of management. Formation of kidney stones can be precipitated by dehydration, especially in the presence of certain salts in the kidneys or in the urinary tract. So it could be kidney stone, it could be stone in the tube that connects the kidneys to the bladder, which is called the ureter. It could even be in the bladder. So for those who have been told that they are at risk of having kidney stones or urinary tract stones formation, it is important that they optimize their water intake. Or even for those that have had kidney stones and have been treated, it is important that they are on top of the game with adequate water intake. It is interesting to even know that those who have very tiny kidney stones or stones anywhere along the urinary tract, taking adequate water could even help to dissolve and flush out these stones. Number 10, water helps to cushion the brain and optimizes its function. As the seat of the central nervous system, the brain is said to be made up of about 1 to 3% of the body's total water volume. And besides, it sits in an environment of fluid called the CSF, the cerebrospinal fluid. Now, with small impacts on the head, maybe like a blow or mistakenly hitting one's head against the door, the cerebrospinal fluid just makes the brain to gradually dance around without wreaking havoc on the brain. Number 11 is a big one. It has a major role in weight loss. Taking adequate water daily has a very major role in weight loss and maintaining a healthy weight. How does it do this? If you take water before your meal, if you take water on an empty stomach before your meal, this is what happens. It is going to help you feel full very quickly. So it helps in achieving early satiety. That is one. Number 2, taking water means you are taking something to fill your system that has no calories. Number 3, taking water adequately helps you to replace refined and processed drinks and beverages that may not be of benefit to your health. Now, if adequate water intake is not achieved in the body, you start to feel dehydrated. And once you start to feel dehydrated, you start feeling thirsty, you start having fatigue, there's decrease in urination, there's increase in the concentration of your urine, headaches and migraines, and other more severe complications of dehydration will start to set in. This is it. By the time you are feeling thirsty, it has become evident that you are already mildly dehydrated. And at that point, you need to start to rehydrate. You need to rehydrate yourself. You need to rehydrate your body with clean, pure water. So at the point of dehydration or symptoms of dehydration lasting for days, or when dehydration has become chronic, you will need the famous water therapy. And many people will come to ask, Doctor, you are asking us to take adequate water. This water therapy, what should we use? Cold water or warm water? Well, research and studies have shown that warm water is better for your water therapy. So for this therapy, follow this very simple, straightforward rehydration protocol. Take out the first 3 days to take adequate water. How do you do this? Every hour on the hour, take half a glass of pure, clean water while you are awake. Every hour, half a glass of pure water while you are awake for the first 3 days. Now you may have concerns about urination. The truth is, with increased water intake, there's going to be increased urination. There's going to be increased urine output. But you realize that you start to feel good. You start to feel rejuvenated in your health. Within these 3 days, your body is able to significantly flush out crazy amounts of toxins and chemicals that has been stored up in your body over time from every refined food that you eat. And in exchange for this, blood pressure is optimized, circulation is optimized such that oxygen and vital nutrients are further pushed to many cells of the body that have become deficient. And by the time you are done with this 3-day protocol of rehydration, from the 4th day, you should start to return to maintaining adequate fluid in your body, adequate water intake of a minimum of 3 liters of drinking clean, pure water every day. So from my consulting room, I'm encouraging you to keep rehydrating, to keep taking adequate water every day so that you can stay healthy, you can stay alive and well. And don't forget, if you've not subscribed to this channel, click on the subscription button, turn on your notification bell, like, comment, and share. Cheers. Wait. One more thing. Let me lead by example.